Good afternoon, everyone. The Indian Health Service Community Health Representative Program is very pleased to welcome you to today's webinar, Learning to Use the Diabetes and Healthy Eyes Toolkit, New Educational Resources for Indian Country. My name is Kathy Steckerman, and I'm the Director of the Community Health Representative Program. IHS is excited to bring you this interactive training webinar in conjunction with the National Eye Health Education Program of the National Eye Institute at the National Institutes of Health. I'd like to now introduce our guest speakers for today. Joining us from the National Eye Health Education Program, called NEHEP, is Niall Amari-Rish, the Director of NEHEP. Niall manages the planning, development, implementation, and evaluation of national health education programs on diabetic eye disease, glaucoma, age-related eye diseases and conditions, low vision, and community and special population outreach. She also serves as the NEI Health Literacy Coordinator and oversees social media for NEHEP.
Thank you, Kathy, and thank you to everyone who registered for the webinar today and for ordering your materials in advance and logged in to participate. It's really an honor to be with you today and to support the critical work that you're carrying out in your communities.
Thanks, Niall. Also joining us is Marcela Aguilar, a Senior Public Health Manager with almost 20 years of experience leading communication and social marketing efforts. Marcela has specialized in developing and facilitating training workshops for health professionals and other adult learners in issues as varied as eye health, reproductive health, HIV/AIDS, school safety, veterans health, and adolescent health. She currently supports NEHEP in reaching populations at higher risk for eye diseases and conditions.
Thank you, Kathy, and thanks to everyone for joining today's webinar.
I'll turn it now over to Niall to get us started.
Thanks again, Kathy, and good afternoon, everyone. Today's webinar was developed to equip you with resources so that you can deliver eye health education in your communities, specifically using our Diabetes and Healthy Eyes Toolkit. We will be covering quite a bit of information during this training webinar. We'll start by discussing diabetes and the parts of the eye. Next, we'll talk about how diabetes affects the eyes. We'll then take an in-depth look at the Diabetes and Healthy Eyes Toolkit. And finally, we'll review some other educational resources that NEHEP has available to help you in your education and outreach efforts. As Kathy mentioned, during this webinar, you'll have opportunities to engage with the content and with the presenters through polls and chats. There will also be time at the end so that you can ask us some questions. In order to make sure we're all on the same page, I want to just quickly cover a few important facts related to diabetes. First, what is diabetes? Many of you already know that diabetes is a very serious disease in which glucose or sugar levels in the blood are high. It can cause problems such as blindness, heart disease, kidney failure, and even amputations. Diabetes disproportionately affects American Indians and Alaska Natives. The latest data from the U.S. Department of Health and Human Services, Office of Minority Health, and the American Diabetes Association show us that American Indian and Alaska Native adults are over twice as likely as white adults to be diagnosed with diabetes. Diabetes is least common among Alaska Natives, with about 5.5% adults being diagnosed, and most common among American Indians in the southern Arizona area, with 33.5% folks being diagnosed. Approximately 30% of American Indians and Alaska Natives have pre-diabetes. This is a critical situation that's being addressed through research, clinical programs, and community and education outreach efforts, such as those that you all carry out. So now it's your turn. Please share with us in the group if you're currently providing diabetes education. You can use your mouse to select an answer on your computer screen and either click yes or no and then hit submit. Okay, great. It looks like a majority of you are already doing diabetes education. And those who are not, we're hoping that what you learned today will help increase your awareness about eye health and the complications of it and address eye health in the diabetes outreach that you'll start to do. So one more question for you. For those who are doing diabetes outreach, do you do eye health as part of the information you provide? So again, click on yes or no, and then click submit. Okay, results are still coming in, but it looks like for those of you doing diabetes education, not everyone is addressing the eye complications. So we're really hoping that you'll learn a lot about diabetic eye disease today and then what you can do to include diabetic eye disease awareness as part of what you're doing with your patients and those in your community. So one more question we would like to know and hear from you is to know what are some typical questions you usually get about the effects of diabetes on vision. So you can type your answers in the chat box in your screen, and I'll give you a couple seconds to think about that. Okay, so some of the questions that we see: how can diabetes affect vision? Will I go blind if I have diabetes? How soon will I go blind? What is retinopathy? If I have lost vision to diabetes, can I regain it? What can I do to prevent losing vision? What are the symptoms of diabetes in the eyes? How does diabetes affect vision? Why do I have to get my eyes checked every year? Okay, and some people said they haven't had questions about it. So, there's a lot of questions that people ask, and we're going to address all of these throughout this webinar. And if you do have other questions you want to share, please continue to share them through the chat box. So I want to go over a little bit about how diabetes affects vision, but first it's important that we learn a little bit more about the eye itself. The eyes, although they're small, are very complex organs, and since we only have an hour together, we're going to focus on just 3 key parts of the eye: the retina, the optic nerve, and the lens. And you can see each of these highlighted on your screen. So let's start with the retina. The retina is the light-sensitive tissue at the back of the eye. It converts light into electrical impulses that are sent to the brain through the optic nerve. A healthy retina is necessary for good vision. Now let's move on to the optic nerve. The optic nerve is a bundle of more than 1 million nerve fibers that carries visual messages from your retina to your brain. And then finally, let's take a closer look at the lens. The lens is a clear part of the eye behind the iris that helps to focus light or an image on the retina. The lens is made up mostly of protein and water. So as we know, diabetes can affect many parts of the body, especially the eyes. When we talk about the eye problems that people with diabetes face, we use the term diabetic eye disease. However, diabetic eye disease is not a single disease. It actually includes these diseases and conditions: diabetic retinopathy, cataracts, and glaucoma. Unfortunately, diabetic eye disease can cause severe vision loss or even blindness if it's not caught on time. But let's take a closer look at what each of these diseases are. We'll first start by reviewing diabetic retinopathy, which is the most common diabetic eye disease. It occurs when diabetes damages the tiny blood vessels inside your retina. If you have diabetic retinopathy, at first you may not notice any changes to your vision, but over time it can get worse and cause vision loss. On the right-hand side of your screen, you can see 2 photos. The photo at the top is a representation of how a person with normal vision sees. The photo at the bottom is how a person with advanced diabetic retinopathy sees. It's important to remember that diabetic retinopathy has no early warning signs. Many years can pass before a person with diabetes can notice changes in his or her vision. In fact, the longer a person has diabetes, the greater his or her chance of developing diabetic retinopathy. If left untreated, diabetic retinopathy can cause severe vision loss and blindness. The earlier you receive treatment, the more likely treatment is to be effective. And the good news is that 95% of blindness from diabetic retinopathy can be prevented through early detection, timely treatment, and appropriate follow-up care. During the early stages of retinopathy, it's really important to control blood sugar, blood pressure, and cholesterol to keep the disease from progressing. In more advanced stages of the disease, laser surgery can help shrink or kill leaky blood vessels. Another surgical option for reducing vision loss due to retinopathy is something called vitrectomy. And in this procedure, the bloody vitreous gel, which is that clear fluid in your eye, is replaced with a saline solution. So it's really important to remind people with diabetes that they should have a comprehensive dilated eye exam at least once a year to help detect diabetic retinopathy in its early stages before the person even realizes that they may have it and have vision loss. So next, let's move on to glaucoma. Glaucoma is often associated with increased pressure in the eye, which can cause damage to the optic nerve. When the optic nerve is damaged, this can lead to vision loss. Again, at first, there are no symptoms. Vision stays normal, like at the picture at the top on the right-hand side of your screen. However, as the disease progresses, the person with glaucoma may notice his or her side vision gradually failing. That is, objects in front may still seem clearly, but objects to the side may be missed, like in the bottom picture. As the disease worsens, the field of vision narrows and complete blindness can result. Fortunately, if glaucoma is detected early and kept under control, vision loss can often be prevented. Therefore, it's very important that glaucoma is diagnosed in its early stages. Glaucoma treatments include medicines such as eye drops or pills, laser surgery, conventional surgery, or maybe a combination of any of these. While these treatments may save remaining vision, they do not improve sight already lost from glaucoma. So people with diabetes are at higher risk for developing glaucoma. It's really important that we continue to educate them about the importance of dilated eye exams and early detection. At last but not least, let's turn our attention to cataract. A cataract is when the lens of your eye gets cloudy. It can occur in one or both eyes, but it does not spread from one eye to the other. As we learned earlier, the lens is made up mostly of water and protein. A cataract is formed when some of the protein in the lens clumps together and clouds the lens. Over time, this cloud may grow and cover more of the lens, and it makes it harder to see. So when a person first gets a cataract, he or she may not even notice much change, like in the top photo at the right-hand side of the screen. However, over time, the person's vision may start to become blurry as if they're looking through a foggy window, or colors may not appear as bright as they once did, like in the bottom picture. As the cloud over the lens continues to grow, it may be harder to read. A person may also start to see more glare from lamps or car headlights that are coming towards them at night. To treat a cataract, an eye care professional may first give a person eyeglasses, suggest brighter lighting or anti-glare sunglasses, or maybe have them use magnifying lenses. But if these don't help, the doctor may perform surgery. The doctors will numb the area around the eye, take out the clouding lens, and then they replace it with a new artificial one. People with diabetes are at higher risk for developing a cataract, so again, very important to encourage them to have a comprehensive dilated eye exam at least once a year. So as we've been learning, diabetic eye disease often has no early warning signs. Early detection is the key to helping protect and maintain vision. For people with diabetes, this means getting a dilated eye exam at least once a year. And this is different from the eye exam that people get for contacts or glasses. During a comprehensive dilated eye exam, the eye care professional will place drops in the eyes to dilate or widen the pupils so that they can see more of the back of the eye and examine it for common vision problems and signs of eye disease. He or she will use a special magnifying lens to look for signs of diabetic retinopathy, cataract, and glaucoma, and other vision problems. And after the exam, close-up vision may remain blurry for a little while, but their vision will return to normal. So that's a really brief overview of how diabetes affects the eye and how comprehensive dilated eye exams can help protect and maintain vision. There are 3 key takeaways from this section of the webinar. First, people with diabetes are at higher risk for vision loss due to diabetic retinopathy, glaucoma, and cataract. Second, these eye diseases and conditions do not have early warning signs, so people with diabetes may be losing their vision without even noticing it. And third, early detection is the key to protecting vision. People with diabetes should have a comprehensive dilated eye exam at least once a year. So what are some of the ways that we can help people with diabetes avoid vision loss? First, you can help educate them about diabetic eye disease. You can also encourage them to protect their vision by getting a comprehensive dilated exam every year. And then NEHEP can help you with both of these important tasks. I'm now going to turn it over to Marcella, who will introduce you to the Diabetes and Healthy Eyes Toolkit and other NEHEP resources that will help you spread the word about diabetic eye disease and the importance of comprehensive dilated eye exams.
Thank you so much, Niall, and good afternoon to everyone. I'm so excited to be able to share a brief overview of the Diabetes and Healthy Eyes Toolkit with you today. I hope everybody has it handy because we'll be taking a look at each of the resources that's included in the toolkit. We're going to take a look at how you can use them and how you can incorporate them into your existing diabetes education and outreach efforts, or start using them to begin educating your community members about diabetic eye disease. So if you haven't already done so, please go ahead and open your toolkit box. And I recommend that you open only one end of the box so that you can continue to use it to store your toolkit. I'm going to go ahead and start describing each of the resources that you'll find in the toolkit. And so please go ahead and locate each resource inside the box and follow along as I talk about each one. We're going to start with the largest and most obvious resource in the toolkit, and that's the flip chart. It's a large flip chart that can be used with small groups of people to educate them about diabetic eye disease. The flip chart covers 8 very important topics. We start with the risk factors for developing diabetes. We also discuss diabetes and eye complications, the anatomy of the eye and its function, and then we talk about the dilated eye exam, and we take a closer look at each of the eye diseases and conditions. Just as we did with Niall, we look at diabetic retinopathy, we look at the cataract, and we look at glaucoma. And then we talk about the importance of having an eye health team to help you preserve your vision, get timely treatment, and ensure that you are preserving your vision as long as possible. Let's take a closer look at the toolkit. You'll notice that the flip chart provides information for audiences on one side and then talking points for facilitators on the other side. That way, the audience will get the key information, and you'll have speaking notes so that you ensure that you provide all of the necessary messages to motivate people to take care of their eyes if they have diabetes. Inside the toolkit box, you're also going to find a small notebook. We call it the educational module. And this is a booklet that contains information about diabetic eye disease and then provides recommendations on how to use the flip chart to conduct an educational session for people who have diabetes. If you open the module, you'll see that it contains certain key sections. So first, it provides an overview of diabetes and diabetic eye disease, and this is to help reinforce the knowledge that you have on both of these topics. And then it provides a brief description on the role of health promoters, community health workers, so discusses the type of work that many of you are already doing in your communities. We also include instructions for using the flip chart and tips for preparing a presentation. As you read through the module, you'll also find step-by-step guidance for presenting the flip chart, including how long the session should last, the types of materials that you need, some talking points, and then hints for your presentation. At the end of the module, you'll find a series of appendices, and these are handouts for participants that you can photocopy or print and then share with people who join you for your educational sessions. I want to highlight one very important appendix in the module. They're all important, but I particularly think you'll be interested by this one, and it's the action plan for participants. Now, this is a handout that you give to participants at the end of an educational session. So once you're done presenting the flip chart, you will give this to the participants and then have them fill it out. And what the action plan does is allow participants to identify specific steps they can take to maintain their overall health and also their eye health. So, for example, getting a dilated eye exam at least once a year and keeping their glucose levels under control. Participants customize the plan based on their own needs and what they feel they can accomplish. And then they can sign it as a way to motivate themselves to carry through with the plan. The health promoter or community health worker, in this case the community health representative, can also sign it almost as a witness and as an assistant to help them carry through on their pledge to take better care of their health and their eye health. All right, we're going to move on to another resource in the toolkit, and this is the Watch Out for Your Vision, If You Have Diabetes, Read This Story booklet. And this is a comic book that you can give to people with diabetes to help educate them about the importance of getting a dilated eye exam at least once a year. And through the comic book, you'll find the story of a woman who starts to learn about the importance of comprehensive dilated eye exams for people who have diabetes. So it's an entertaining way to provide important health information for your community members. Another resource that you're going to find, and both the Watch Out for Your Vision booklet and this resource that I'm going to talk about now, the Medicare benefit card, those can be found inside the small folder that's included as part of your toolkit. So you open that up, you'll find the booklet, and then you'll find this Medicare benefit card and a series of other materials that I'll cover. So this Medicare benefit card helps promote the diabetic eye disease and glaucoma benefit offered by Medicare. And it's a resource that you can order ahead of time and then hand out to the participants who may be eligible for this benefit as a way of informing them and reinforcing the need to get treated for diabetic eye disease and for glaucoma. Inside the folder, there's also a small magnet, and it's called the Track Diabetes Magnet. It gives tips to people with diabetes about keeping their health on track. And what does that mean, keeping their health on track? It's an acronym where the T stands for take your medication, reach and maintain a healthy weight, add exercise to your daily routine, control your blood sugar, and then K for kick the smoking habit, so TRACK, track. Again, this is another resource that you can give to participants. They can put it on their fridge or somewhere handy, just as another reminder to make sure that they're getting a dilated eye exam and then taking care of their overall health. Each copy of the toolkit also contains a publications order form that you can use to order free copies of the Medicare benefit card, the Watch Out for Your Vision brochure, and the Track magnet. And as a bonus, you can also order one free copy of the toolkit. The great thing about this order form is that it's postage prepaid, so all you have to do is select the resources you want, fill in your mailing information, seal it with tape, and just drop it in the mail. We'll get it here over at NEHEP and send the materials on their way to you. We've also included an evaluation form in the toolkit, and that allows you to share your experiences and recommendations with NEHEP. Just like the materials order form, this is also postage prepaid so that you can just drop it in the mail. And we always value your feedback and your comments, so I highly recommend that if you use the toolkit, if you could just please take a few minutes to jot down how you used it, where you used it, with whom, and then any thoughts that you might have about the content or about the format, and just drop that in the mail and send it to us. Again, we would really appreciate any feedback that you can provide. Now, in order to make it as easy as possible for you to copy, print, and present materials during your educational sessions, we've also included a CD-ROM inside the toolkit, and this has PDFs of all of the toolkit materials, from the flip chart down to all of the appendices and the educational module. So you just pop this into your computer, and you're able to access all of the resources inside the toolkit. So that's it for the toolkit. And now that you're familiar with the contents, I wanted to take a minute to review how you would actually prepare to conduct an educational session, and then what that educational session would look like. So in order to prepare, first, of course, you want to make sure that you review the flip chart and the module so that you are as familiar as possible with the content and the process of presenting the information. Next, you're going to want to identify a place to conduct your educational session. Now, this could be a clinic waiting room, a senior center, a community center, or even a living room. And then, of course, you're going to want to find and invite participants to the educational session. People who have diabetes, their loved ones, friends and family members, people who would benefit from receiving this information. You should also go ahead and order any NEHEP materials that you will need so that you can hand them out to the participants and you can have them ahead of time. Also make sure that you have copies of any of the handouts that you will use. Again, you can either photocopy them directly from your module or print them off of the CD-ROM that we included in the toolkit. Sometimes the session, when it runs a little bit long, you might want to offer a snack for your participants. And if you do so, we just recommend they're healthy snacks. Because we're dealing with people who have diabetes, we want to make sure we're mindful of any dietary restrictions that they might have. Some of the handouts that you will use during your educational session require that participants complete information, fill out forms. So you want to make sure that you are collecting pens or pencils that the participants can use during the session. And then, of course, you want to make sure that you have your flip chart and module ready to go. Now, in terms of the educational session itself, there are many ways to conduct it. And what we have done is provided you just a general guideline or some general guidelines on how to best conduct the session. So let me just review that and then tell you a little bit more about how it can be customized. So one way to conduct the educational session is first ask participants to introduce themselves. That way they get to know each other and you get to know them if you don't already. And really that only takes about 5 minutes of your time. You can then have participants complete the pre-test, which is included in the educational module. And this is going to help you determine what participants know before the session starts. Again, should only take about 10 minutes of your time. Next is really the longest part of the educational session, and that's presenting the flip chart. Should take a little less than 1 hour, so we're looking at about 50 minutes to go from beginning to end of the flip chart. Next, you're going to want to facilitate an educational activity which helps to reinforce knowledge for the participants. And the instructions for that educational activity are actually included inside of your module. So you can take a moment to review that. It should only take about 10 minutes to run through the activity itself. As we've already discussed, we want to make sure that participants fill out an action plan, and that really only takes about 5 minutes to help them identify the concrete steps they can take to protect their vision. The action plan, as I've mentioned before, is an appendix included in your educational module. And then finally, you're going to want to close the session and have participants complete a post-test. And this is going to help you determine how much participants learned. So as you'll see, the session is estimated to last about an hour and 30 minutes. However, we understand that not everybody is going to have all of this time to present the content. Therefore, we recommend that you review the module and the flip chart and identify the content that you feel is the most important for your group or for your community members. I've already mentioned some ways that you can access the information in the toolkit, whether it's in the hard copy or on the CD-ROM, but I also wanted to let you know that you can access the materials on the NEHEP website. So on the NEHEP website, you can download all of the toolkit materials, and you'll also find a PowerPoint presentation that you can use instead of the flip chart. So if you have access to a laptop and a projector, you can actually grab this PowerPoint, download it to your computer, and then project it so that you have a different way to share the information with your community members. The PowerPoint file also includes the talking points, just like the flip chart does, so you'll have all the information you need in one place ready to go. And the website URL is right on your screen. It's www.nei.nih.gov/diabetes toolkit. And we'll present this URL throughout the rest of the webinar, so you can jot it down as we continue. Also on the NEHEP website at the same URL is an interactive online training course that you can take to learn how to use the toolkit. Now, the online course contains a lot of the same information that we covered in today's training webinar, but it also covers some additional content, including the educational activity that we've been mentioning throughout the second part of the webinar. The online training course takes about 45 minutes to complete, and the great thing is that at the end, you'll receive a personalized certificate. So that's the online training course at www.nei.nih.gov/diabetes toolkit. In addition to the Diabetes and Healthy Eyes Toolkit, NEHEP also has numerous resources that you can download or order on the website. And this includes materials such as booklets and posters, fact sheets, articles, infographics, and even public service announcements. And these materials covers a range of eye health information, everything from general eye health to glaucoma, cataract, low vision, sports-related eye safety, and vision and aging. And you can see the URL for these NEHEP resources right on your screen. It's www.nei.nih.gov/NEHEP. And again, we'll repeat this URL towards the end of the webinar so that you can note it down. So that is the introduction to the Diabetes and Healthy Eyes Toolkit and to some of the other NEHEP resources. And we have some time left for questions. So I wanted to open it up to any questions that you might have. And you can just use the chat box to ask the presenters any of the questions. And remember, the chat box is located on the bottom left-hand side of your screen. And I just want to mention that if you ask a question and we're not able to get to it, someone is going to send you a response via email after the webinar. So we will try to get to everybody's questions, but in case we don't, you will receive a response afterwards. So here we go. We're opening up the chat, and we'll start answering your questions. So we have a question coming in. This is for Niall. Niall, are people with diabetes at higher risk for developing glaucoma or cataract?
So yes, I'll just reiterate from earlier, people with diabetes are definitely at higher risk, not just for diabetic retinopathy, but also for glaucoma and cataracts. And this doesn't mean people with diabetes aren't also at risk. People who do not have diabetes obviously are not at risk for diabetic retinopathy, but they are at risk for glaucoma or cataract as they age. It's just that people with diabetes are more likely to develop these conditions as a result of the complications of diabetes. But it's really important for everyone to protect their eyes as they age, but especially for people with diabetes, making sure that they have a dilated eye exam at least once a year to detect these conditions and other things early is really, really important.
Great, thank you. And are there any financial resources available for people who want to get eye exams but can't afford them?
Yes, we have information on the NEHEP website, which is here on your screen. There are organizations that do provide financial assistance to help pay for eye care, again, Medicare, as we talked about earlier. And then, Kathy, I'll let you answer because I believe some people have asked if IHS pays for eye exams, and I know that's a question that's coming through. So can you add on to that?
Sure, I'm happy to do that, Neil. American Indian Alaska Native persons who are eligible to receive IHS services can obtain those eye exams at their local IHS or tribal facility, of course, if that facility is equipped to provide those types of services. For those locations that don't have staff and equipment to provide eye exams, the patient can contact his or her IHS or tribal primary care provider, and together they can work with contract health services. And in our system, CHS is now called Purchased or Referred Care, PRC. They can work with their doctor to ensure that a properly authorized referral and commitment to pay are made. And I say that really because eye exams without that kind of proper prior approval from CHS, it will end up being the patient's responsibility to pay. And then again, I'm just really pleased with all of the other options that's offered on the NEI resource listing. So thanks for that.
Thank you so much, Kathy. And we have a number of other questions coming in, so we're going to move to the next one. Are there any continuing education credits for the online training? That's a great question, and unfortunately there are not. However, as I mentioned, we do provide that certificate of completion at the end, and some continuing education associations or providers actually do accept that type of certificate for CEU. So I recommend that you go online, complete the course, and get your certificate. And let me just mention actually that everybody who has registered and logged on to today's webinar will receive a copy of the certificate after the webinar is done. And it's the exact same certificate as on the online training course. You'll be able to type in your name, today's date, and you can print that certificate or save it to your computer. Okay, we're going to move on to the next question. Niall, what should people do if they have already lost some vision?
That is a great question. So we mentioned the term low vision earlier when we were talking about some of the resources earlier. Low vision means that that's vision that people have experienced if they've already lost vision due to eye diseases like glaucoma or cataract or diabetic retinopathy, vision that can't be corrected with glasses or surgery or anything else. So it's really important that there's things to know that there's vision rehabilitation and services and devices out there that can help people make the most of vision that they do have. Every state has an association for the blind that can be contacted to help people find resources in their local area. So that's one way to find information. Also, if you visit the NEHEP website and look under our low vision program, we provide links to resources of other organizations that help people who've already lost their vision so that they can learn how to maintain their independence and quality of life, to continue managing their diabetes. So there is help and hope out there. So we just really want to make sure that people know, life isn't over if you've lost vision, but there's so much that can be done for people with diabetes to prevent vision loss in the first place. And I want to go back to that number of 95% of vision loss can be prevented. And I just think that's so crucial to remember, that to tell people not to wait till they notice problems with their vision to go get an eye exam, just to make sure that they make it part of their own diabetes health management to get a dilated eye exam every year.
Thank you, Niall, and that's actually a great segue into the next question. If a person has been diagnosed with a diabetic eye disease, is there a cure or a way to bring their vision back close to normal?
So the answer to that, unfortunately, is no. With diabetic retinopathy, and depending on how advanced it is and if the blood vessels are really leaky, and without getting into all to the technical stuff, there are some treatments where they can do injections into the eye to stop some of the blood vessels from leaking, and some little bit of vision can be restored, but the vision that's already been lost is never going to go back to what it was. And that's the same for glaucoma. So it's really important, again, the early detection, the early treatment before it happens is really the key. You really cannot really restore vision that's been lost.
Thank you for that important information, Niall. We have another question coming in. Are the handouts seen on the NEHEP site able to be ordered like the toolkit materials? So the resources that we showed, the brochures, the pamphlets, the magnet, all of those resources can be ordered on the NEHEP website. You just go to www.nei.nih.gov/NEHEP, and you'll see the URL right on your screen. And you will access the catalog from that website and where you can order the materials that you need. So great question. Thank you very much for that.
Sure. And can I just add to that, Marcella? We just put up a slide that has my contact information. So if you're looking for something that you can't find, or if you have a question, please email me. Feel free to call me. We're happy to provide these resources to you. It's really more important to us that we get them out there and that you can use them. So if there's anything that you do want, again, feel free to contact me, and we'll provide them to you. And we do not charge for materials. There's a shipping and handling fee if you order them from the website, but if you contact me directly and you tell me that you're part of the CHR program, we'll send you those materials for free, and we can waive that shipping and handling, so just let me know.
Great. Thanks, Miao. What kinds of treatments are there for diabetic eye disease, Miao?
Again, that's a complicated question because it really varied. Going back to diabetic retinopathy, when it's diagnosed early, really the treatment is really control of glucose levels and blood pressure and cholesterol, and those are some of the key things that can really preclude the disease from progressing to advanced stages. But if the diseases do progress and people have things like macular edema or other things that can happen with retinopathy, there's laser surgery, there's conventional surgery, there's different things that can be done. Again, I have to reiterate because I think it's so important. It's about the early detection. The earlier it's treated, the more likely it is to work. Glaucoma is more complicated, because it's a very complicated group of diseases. But usually eye drops are one of the ways it's treated, or through regular surgery. So it can be treated if it's controlled, but again, vision loss that's already lost from it can't be brought back. And then cataract surgery is typically the main way that cataract is treated, especially when it's in its advanced stages.
Thank you, Niall. And actually that brings up a very important question, which is what should CHRs, community health workers, promotoras, what should we do if we get asked a medical question during one of our educational sessions? And I will go ahead and answer that. So as we do our health education and outreach work, these types of individual questions do come up once in a while, and it requires very specific medical knowledge, or it requires that a physician be involved to provide diagnosis and treatment. So the best thing that we can do when carrying out our educational sessions is really to refer that person back to their primary care provider, to their eye care provider, the ophthalmologist, so that they can provide the correct diagnosis and treatment options. That's not our role as community health workers and health educators. We provide the information, we make the link back to the health professionals, and those health professionals are able to provide the more detailed, in-depth medical information. So I know those of you who are out delivering these educational sessions, this is a situation that comes up a lot. So just continue to refer those people back to medical professionals, and I think that's the best way to deal with those types of questions. Niall, we're also getting a question here about people who do not have diabetes. Now, can they develop glaucoma and cataract too?
Yes, anybody can develop these diseases, especially the older you are, the more you are at risk for some of these eye diseases, but there's a lot of things that people can do to protect their vision. I mentioned the dilated eye exam, but there's also lifestyle factors. Some of the very things that were mentioned in that track magnet that you mentioned earlier about maintaining a healthy weight, exercising daily, eating a really well-balanced diet, especially foods like dark leafy greens like spinach or kale, or fish that's high in omega-3 fatty acids like salmon or halibut. Those are types of foods that are really good and have shown to have eye health benefits. You mentioned the not smoking. I can't stress that enough. Smoking is as bad for your eyes as it is for the rest of your body. So encourage folks to not smoke. But also simple things like eye protection from the sun. So wearing sunglasses with UVA and UVB protection and a wide-brimmed hat when you're outside can really help protect your eyes, especially from something like cataract, which we know that UVA and UVB rays can cause. And wearing protective eyewear when you're playing sports, or if you're outside gardening or doing chores around the home, it's really important to wear protective eyewear to prevent things from flying into your eyes.
Great. Thank you. We also have a question about ordering resources again. Now, are the resources available for order only one time?
No. So the great thing about a lot of these materials are downloadable. So if you want to just download them and print them, you can do as many times as you want. Or if you need bulk copies, that's totally fine. Again, please contact me, and I'm happy to give them to you many times because, again, we really want to get these out into the community. So we're happy to provide them as many times as you need them.
Okay, and we have another toolkit question coming in. For those of us who are working in Spanish-speaking communities, are these resources available in Spanish? And the answer is yes. The toolkit and many of the resources that we shared with you are available in Spanish, so you can go ahead and order them and distribute them, share them with your Spanish-speaking community members. Again, that's through the website that we shared before, www.nei.nih.gov/NEHEP. And here's a question on the educational session. So how many people do you recommend take part in an educational session? That's really a great question, and I want to say that we recommend about 8 to 10 people take part in an educational session. The flip chart was developed for small group settings, and this is a nice number so that you're getting good interaction between the participants, with the facilitator. It's a manageable number. However, as I mentioned earlier, we see this as a very flexible resource, a very flexible process. So we know that some of you only present to one person at a time, and that's absolutely fine. Some of you present to 25 or 30 people at a time, and again, absolutely fine. Really, the resource is meant to be used as you need it. We provide the key information, the guidance, and then you take that and integrate it into your existing efforts, or you use it as best fits the circumstances for your community. Let's see. We have a question about getting a dilated eye exam. Where can people get a dilated eye exam?
A great question. I mentioned earlier that a dilated eye exam is not the same thing that you get for contacts or glasses, but your ophthalmologist or optometrist are both qualified to perform comprehensive dilated eye exams. So when you go to the eye doctor, you can ask for one. So they're the ones that are trained. That brings up another issue. A lot of people ask about the dilation versus the cameras, that they know that there's people out there that can examine the eyes with cameras. So yes, that is true, and it's really great for telemedicine when people don't have easy access to an eye care professional in their community. That the cameras are great. They'll take a picture of the retina, and they can see if it looks like there's any signs of disease or damage. So those certainly work, but the National Eye Institute really encourages folks to get the dilated eye exam, have the eye care professional actually place the drops in their eyes and look at their eyes instead of looking at the picture, just to make sure that they don't miss anything. So again, visit your local eye care provider, and if you don't know where to start looking for one, we have information on our website to help people find a local eye care provider in their community. So again, look at our website and you can find that information there.
Thank you, Niall. We're getting a lot of questions about the webinar itself, and I just wanted to share with all of you that the webinar is going to be made available to you at a later date, both on the NEHEP website and through IHS. So you'll be able to view this again, but we'll also be sending you copies of the slide immediately after this webinar ends. So you'll have the slides, and then you will be able to go back to an archived version of the webinar. Kathy, looks like we have a question for you. How can I follow up with my patients to help them make changes to their health behaviors?
Wow, that's another super question. I've been very impressed with the Diabetes and Healthy Eyes Toolkit. They provide some great resources in there for CHRs to use to help their patients take small steps in order to make positive changes in their lives. And one of those is with that action plan. I think it's Exhibit E in the module booklet and on the CD itself that's in the toolkit. Doctors and nurses often use this type of tool with their patients, and in the health system, we call that the Brief Action Plan, or BAP. Kind of a funny name, but that's what it's called. We recommend that CHRs share the entire toolkit with their clinic staff, and then also discuss how they as CHRs plan on using it. And also check in with clinic providers to see if there's a local BAP form that the clinic providers suggest they use. And maybe they can even work with the clinical providers together to improve the clinic's form by incorporating elements of the action plan that's found within the toolkit itself. So those are a few of the ways that CHRs can follow up with their patients to help them make those changes. That's such an important part of helping the patient do their own self-management and what we call self-management support on the part of CHRs. They're fabulous at that kind of support, and patients really appreciate that. So thanks for asking that question.
Thank you so much, Kathy. We have another question coming in. Suppose a patient's dilated eye exam shows damage, but the patient has no other symptoms. Is the progression to vision loss not stoppable? Neil?
Well, again, that's something that a person needs to talk about with their eye care professional. Again, early detection, if they're not noticing symptoms, the eye doctor is going to see it, and they'll decide what the best treatment is at that time. I have to stress the importance of glucose control and a healthy weight and controlling blood pressure and cholesterol, because a person can just have very mild diabetic retinopathy, and if they are really good at controlling their diabetes and keeping up with their health, that they can stop the progression of it or really slow it down. So those lifestyle factors are so crucial. It does not have to progress. People do not have to go blind from diabetes. And I can't stress that enough, that there's so many things that people can do to protect their sight. So if they are starting to notice damage, while that damage can't be reversed, it can be prevented from going further.
Very important. Thank you, Neil. We're also being asked if there are any other webinars provided through NEHEP.
The answer to that is yes, and thank you for asking. We have done other webinars that are archived on our website. So if you visit the NEHEP website that's up there on your screen, there's a link to webinars. So you can find other information about eye health topics. And this is the first webinar that we've done in conjunction with the Indian Health Service, and we're certainly open to doing more with you all. So Kathy, we can talk in CHRs. If you have topics about eye health you'd like to see, let us know, and we're always open to doing more with you all. Another thing I just would like to suggest, if you're interested in learning more about our webinars and some of our materials and some of the things we have coming down the pike, if you visit our website, you'll see a link to our Outlook newsletter, which is our e-newsletter, where we put out announcements and things that are new materials or things that our partners around the country are doing that you may be able to get involved in. So I'd encourage you to sign up for our newsletter. And then Kathy is also the representative from the Indian Health Service with the NEHEP program, and I know that she's really great about sharing all of our our emails and forwarding them to you all, so stay tuned that way too.
Very good. Another question on the toolkit. What sections of the flip chart are the most important to present? That's a really great question, and I think it depends on your particular situation, how much time you have, where you're presenting. So, as I mentioned earlier, we recommend that you just take a look at all of the content that's included in the flip chart, and then determine for yourself, well, how much people may already know or not know about diabetes, and about the anatomy of the eye, and about each of the diabetic eye diseases and conditions. So it's really up to you and your particular circumstances. But we do have those three key takeaways that Neil covered. The first, the lack of early warning signs and symptoms, the need to get a comprehensive dilated eye exam at least once a year if you have diabetes, and then finally, just that people with diabetes are at higher risk for vision loss. So those would be the three key messages that you want to share with your educational session participants or community members, and use the flip chart, of course, as a way to deliver that information.
Okay, so we're getting close to the end of time. You guys have given us great questions. Please keep them coming. For those we didn't get a chance to answer, we will get back to you. But in the interest of everyone's time, I really want to say how grateful we are on the behalf of NEHEP to participate in this webinar with you and to work with the Indian Health Service and the CHR program to bring this information to you. It's been a great partnership, and we look forward to other ways to help you meet the eye health education needs in your community. So on behalf of Marcella and I really want to say thank you, and I'll pass the torch on to Kathy to give closing comments, but express my gratitude for you all.
Thank you, Neil. I really appreciate it, and Marcella, you too. I really want to emphasize to our folks and express my appreciation, Neil, for the years that we've had this opportunity to partner together, and also for your kind offer today that I hope that everyone took note of about contacting you directly for any kind of materials, and especially because you know how CHR programs are always very cost conscious, so that shipping and handling costs would be eliminated for them. I just am really appreciative of that and of the many, many resources that this toolkit has. So for everyone on the call, on the webinar, I have just a few items before we finish. Once this webinar ends, an evaluation form is going to appear on your screen. Please take a moment just to answer a few questions. The presenters and I value your feedback, so please do that. Everyone who registered and logged into the webinar today was going to receive a certificate of completion by email. The certificate can be customized with your name and today's date, so you can print it or save it to your computer, however you'd like to do that. However, certificates will not be available for those who are viewing an archived version of this webinar. We'll be sending everyone a copy of today's slides, also archiving this webinar on the NEHEP and IHS websites. So with that, I'd like to thank you everyone for joining us in today's webinar. Please remember to complete the survey. Goodbye.